Pandemic and the growing frustration among healthcare workers in this country. Doctors and nurses from nearly 100 hospitals now joining together in a new effort to convince Americans to wear masks. NBC News correspondent Gabe Gutierrez has more.
This morning, hundreds of nurses are on strike at a Philadelphia hospital, protesting low staffing and rising frustration over the COVID crisis.
I am very concerned about what's going on in there right now.
Now, across the country, healthcare workers from nearly 100 hospitals are joining forces with an urgent plea. Wear a mask. The new PSA shows images of overworked and exhausted doctors and nurses begging for help. It's not just a staffing shortage.
There's not enough of us to help.
But also a lack of bed space.
It's exhausting. It's overwhelming.
Dr. Nicole Gilg works at Broadlands Medical Center in Iowa, where the ICU is full.
I think there's a sense that no one is listening to us. And it really does feel at times as if we're on the field, we're fighting fires, and yet people continue to set fires.
Doctors and nurses are also becoming patients themselves. More than 900 staff members at the Mayo Clinic in Minnesota and Wisconsin have been diagnosed with COVID in just the last 2 weeks. At the Cleveland Clinic, 880 caregivers are out due to COVID.
If we as healthcare workforce members become exposed to someone with the virus, we would have to quarantine for 2 weeks, which puts us out of the workforce.
In a virtual roundtable, President-elect Biden became visibly emotional while hearing from an overnight ICU nurse from Minnesota who told him she's never even been tested for COVID, despite working on the front line since February.
You got me emotional. You're all making extraordinary sacrifices. There is hope on the way.
But this is the sound of gratitude. This patient in Utah, intubated and unable to use his voice, instead played the violin to show his appreciation.
To be able to put aside all of his own needs, to be able to play for the rest of the staff members, it was absolutely incredible.
Gabe Gutierrez reporting there. Joining us now, former acting director of the CDC, president and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. This morning, he has a new op-ed in USA Today titled COVID-19 Tsunami of Suffering. The pandemic isn't pausing. U.S. shouldn't either. Dr. Besser, it's great as always to have you with us. Boy, how frustrating it must be for you to watch and see doctors still having to tell people to wear masks, still having to tell people to distance. And I'm struck by how this is playing out exactly the way you and other public health experts told us it would back in February and March, that we'd go through a very difficult time. It might subside a bit in the summer and then come back with a vengeance in the fall and the winter. And here we are. So what can we be doing right now? What should be happening this morning?
You know, Willie, that's the big question. How do you get people who are, understandably really tired? They're tired of being afraid. They're tired of having to change their lives. How do you get them to do those things that we know work? They worked in the spring when the numbers went down in the states where they were high. Wearing masks, social distancing, washing hands, closing indoor gatherings, shutting down movie theaters and bars, and going back to pickup instead of indoor dining. Those things work, but the appetite for doing them is at a low. And when you hear such exciting vaccine news, instead of saying, okay, we're going to double down and do everything possible to get through this winter in a safe way, people are saying, thank God we don't have to do that stuff anymore. The vaccines are here. And that's not the case. They're not going to help us this winter.
So Dr. Osterholm was on a couple of minutes ago and said bluntly, please don't swap air. And by that, he meant don't be in confined spaces with groups outside your household. Don't do a big Thanksgiving. Even when you have a mask on, sometimes if you've got a bunch of people in an indoor space, you're swapping air with them, and that can be very dangerous. He also said, Dr. Besser, which kind of stopped us in our tracks, he said this moment right now, as we sit here, is the most serious in American public health since 1918. So what is your assessment of where we are as now we head into Thanksgiving and the holidays?
Yeah, I think Mike is right. He's got a blunt, clear way of helping people visualize this. This is the time of year when viruses thrive. They love the cold. They love low humidity. They love it when we're in close indoors, when our behaviors change. We can't spend time distant in a way that we enjoy. Activities move indoors, and viruses just take off. And if we don't follow the science, if we don't do these things, it is going to be a dire winter. The other part of this, Willie, and I know you all talked about this earlier, is that following the science means following the science. And in many places, schools have been able to open safely. I'm a pediatrician and a parent, and for many children, being in school where they can be observed watching masks, observe social distancing, is the safest place for them. And we haven't seen much in the way of transmission between students and to teachers and staff. We need to make sure teachers and staff are safe. But if the science is saying it's the safest place for everyone to be, let children be together. Let them learn. It's great for their physical and mental health. It's great for their education. And in many places, it's the safe place for them to be as well.
Well, it's an interesting point. We were talking about the New York City schools closing because they reached that 3% positivity threshold citywide, not inside the schools where the positivity rate is less than 0.2%. What's your view of that decision? We know these are not easy calls. We know they're all taken seriously by doctors and by, school administrators. But do you think New York City schools should be open?
I do. I really do. And, I want to own it that when the decisions were being made to open schools and get kids in, one of the things that I said and so many said is that you're not going to be able to open schools safely if you can't control this first in the community. And so get it under control and then open schools. But what we've seen is that schools can be opened quite safely. You don't want to do it. You don't want to start doing that when the numbers are really high. But New York has really been a model for how do you do this. They've done regular testing. They've ensured there's distancing in the classroom. It's a hybrid model. So many students are learning from home. But the disparities here, not being able to provide in classroom learning for so many children, will further the gap between those in communities that are haves and those that are have-nots. And in America, where so much education is funded off of property taxes, it's so incredibly unfair to say we're not going to allow children to come to school, even though we're not seeing that really as a public health risk.
And that's the frustration, as you say. It was going well in New York City for these schools. It was a success story that has now been stopped. Dr. Besser, Yamiche Alcindor is here with a question. Yamiche?
Good morning, Dr. Besser. Thanks so much for being here. My question is, what's your best advice for vulnerable populations and communities that don't have the privilege to do things like social distance or work from home? I've talked to so many immigrants who have to go to work, who have to take public transportation, who live in an apartment that's 7 people with 2 bedrooms. What should they do to stay safe as these spikes continue?
Yeah, when you look at why Black Americans, Latino Americans, Native Americans are being infected, hospitalized, and dying at incredibly high rates, the biggest factor in that is differences in exposure. So many are essential workers doing those things to keep society going. What it's going to take is ensuring that Congress steps up and provides people with what they need to be safe. There are many people in America who are forced every day to decide between going to work to put food on the table and pay the rent or staying home so that they can be safe. And back in the spring, Congress came together. They put money in people's pockets. They put up moratoria around evictions. They expanded the unemployment benefits. They expanded the sick leave and medical leave benefits. That's all gone. And a lot of people who shouldn't be going to work, who should be home, either because they've got some symptoms or they're very high risk, they can't afford to do that. In January, there are tens of millions of renters who are at risk of being evicted. And Congress has done nothing. It is absolutely, it is criminal that Congress can't come together and provide people with what they need. And different people in different communities have different needs, and those needs need to be met.
And many of those members of Congress on airplanes right now going home for the next 10 days, back for a couple of weeks, and then we're into the holidays. So the hopes for a big package are dim. Dr. Rich.
Let's be clear about this, that the Democrats in May of 2020 passed the HEROES Act, which would do all those things he's talking about, but the Republicans in the Senate did not take up the bill at all. So we need to be very clear with the American public. That's why certain people in America vote against their own self-interest, because it's not clear exactly what's going on in the country.
Richard Besser, it's always great to have your point of view on the show. Thanks so much. Mika?
Still ahead with little